my name is Sandra. And today we'll be going over how we should make vaccines mandatory for school attendance. So as you're sitting here, most of us probably got sick from interacting with peers, touching things outside. You don't wash your hands, then you go back inside, and then you like maybe eat, I don't know, but you get sick in all sorts of ways. Something making this a requirement is overstepping boundaries, and it should remain a personal choice. But should one person's personal choice have the power to affect the health and safety of an entire community? First, we go over public health and how vaccinations work. And then we'll go over some high-risk environments where you can get diseases. And then we'll talk about how they protect vulnerable students. And then how vaccinations reduce outbreaks. So first, vaccinations protect public health by preventing illnesses. The vaccines they train your immune system. They recognize and fight pathogens, which include like viruses, bacteria, and other things by introducing a safe and weakened part of an inactive antigen. This triggers production of antibodies and memory cells without causing the disease. Research done by the CDC shows that vaccination routines for children born in 1994 through 2023 will have prevented over 508 million illnesses and 32 million hospitalizations, and have saved over 1.1 million lives. Next is high-risk environments. The first is crowded spaces, because you're interacting with people. Places with poor ventilation, so public transport, buses, and other things. Next is offices and gatherings, so weddings, funerals, churches, parties, all of that. And then healthcare facilities, like hospitals and clinics, because the people that work there, they tend to interact with the patients. And then places that have high level of air or water pollution. This is because insects mostly linger around the areas, so like mosquitoes, they mostly linger around water pollutions. And mosquitoes mean malaria. And malaria at the moment, I don't think has any cure. And when people do get malaria and they have no way to afford the healthcare that comes with it, they tend to die. And then places that have damp and damaged buildings, they include like dust, fungi, and mold. And this causes chronic respiratory and heart diseases. Next, we talk about how we could protect vulnerable students. This one is herd immunity. This only works when a higher percentage of population becomes immune to an infection through vaccination or prior illnesses. It makes it difficult for diseases to spread, and it creates a shield so people such as newborns or others who cannot be vaccinated due to medical conditions remain safe. And then how vaccinations reduce outbreaks. Vaccination requirements reduce outbreaks by keeping vaccination rates high. When rates fall, outbreaks increase. And about 95% of a community needs to be vaccinated, but rates have dropped to about 92.5%, which leaves thousands of children at risk. So all in all, I think we as a community can work together, get vaccinated, and be safe.
So, thoughts?